Democrats, of course, caved on the shutdown fight, throwing into the fire any hope that the ACA subsidies are going to be continued. But it turns out that that might actually only be the beginning of the problems for people's continuing access to healthcare, let alone affordable healthcare in any form, because Dr. Oz was dispatched and to the media, and there's a lot of questions for what the Republicans are going to do when it comes to healthcare, and he doesn't seem to want to provide any more details than anyone else the Trump administration has so far. So take a look.
The full counter-proposal continuing resolution rolls back the Medicaid savings of $1.5 trillion. Republicans are never going to go for that. So do you have a thought on how you want to see this play out once these subsidies do expire this year?
You always ask the right questions, Maria. So I spent a good part of the weekend with the White House working on exactly the answer to that question. We have lots of great ideas, but I don't want to show our cards. As the president often says, why would I telegraph to you what we're going to do?
Well, to be fair, the president often says you'll have the plan in 2 weeks, and we've seen how that's gone over the last decade. So, yeah, no, I don't expect anything good to come out of the Republican Party when it comes to healthcare. Maria Bartiromo just says the subsidies are going to be gone. She just accepts that. He doesn't discount it, or he doesn't correct her. She also referred to it as over $1 trillion in savings in Medicaid. They just cut it. It's not savings. They're just spending less on it, so you'll have less if you rely on Medicaid. And what's their plan? We were working on it. We have stuff we're not going to tell you, but don't worry. I'm sure Jackson, it'll be here in 2 weeks. What do you think?
Oh, of course, it was going to be here in 2015, and then they just had a couple bumps in the road, and then during the campaign, they had concepts of a plan, and then, as you pointed out, they cut Medicare and made it more difficult and more expensive for people to get the help that they need. So now, of course, they're finally going to come out. They're finally going to come out of the closet with their plan and let us know. No, they don't have a plan. I mean, they don't care about having a plan. They just care about making life more difficult for the regular citizen. Honestly, at this point, that's really what it's about. Sure, they want to squeeze people's pockets, but they also are in the game of subjugation. I mean, what else is there to say? Y'all ain't got enough money. Elon Musk and his ilk don't have enough money. No, these people, Peter Thiel and his obsession with the Antichrist and transhumanism, people being cyborgs and stuff like these people are trying to influence the direction that humanity is going. They have, just like one of them has enough money to basically end world hunger, but they just don't do it, which I think is a very good indication that people shouldn't have this type of wealth. But I don't think there's really a way to stop that at the end of the day.
I know they're focused on making us live forever. Could we just live to 70, please? That would be a good first step. But again, they're not worried about us living forever. They're worried about them living forever.
Yes.
Meanwhile, we don't have time to dive into it, perhaps tomorrow on the show. But Trump is now openly talking once again about just killing Obamacare entirely, and he's pitching it as a populist thing. Rather than giving money to the big bad health insurance, you'll get the money and you can spend it on your health care. And follow-up question: where would that money then go? It's moronic. He has not learned one single thing about healthcare in the last decade. And so we'll see what's coming, but we're certainly not going to be given any indication of it before it's here.